Welcome to this exploration of citrulline and blood pressure. You might know citrulline as the amino acid that gives you a bigger pump in the gym, but its benefits extend beyond muscular fullness. In this presentation, we will look at how citrulline is metabolized in the body, how it influences vascular function, and what the scientific evidence says about its role in supporting healthy blood pressure. The goal is to provide evidence-based insights that go beyond gym folklore and help you make informed decisions about your supplements. Most people associate citrulline with enhanced blood flow during workouts, but there is growing curiosity about its potential to support cardiovascular health. Can the same compound that fuels a satisfying pump also help manage blood pressure? In this talk, we will bridge the gap between performance and health by examining the research on citrulline's effect on arterial function and blood pressure. It is important to separate gym hype from clinically relevant data, so we will focus on controlled trials and meta-analyses rather than anecdotes. When discussing supplements, it is useful to separate performance benefits from broader health benefits. From a performance perspective, citrulline enhances blood flow to working muscles, giving you a pronounced pump, supporting endurance, and helping delay fatigue. From a vascular health perspective, the same vasodilatory properties relax blood vessels, reduce vascular resistance, and may lower systolic blood pressure slightly. Understanding both sides allows you to appreciate how citrulline can influence your gym performance and your cardiovascular system, without confusing the two. Citrulline itself is not directly active. After ingestion, your body converts L-citrulline into L-arginine, an amino acid that fuels nitric oxide synthase enzymes. These enzymes use arginine to produce nitric oxide, a gaseous signaling molecule. Nitric oxide travels to smooth muscle cells in the walls of blood vessels and triggers them to relax. This cascade results in vasodilation, allowing more blood to flow through your arteries and capillaries. In short, citrulline serves as a precursor to arginine, which in turn fuels nitric oxide production. The pathway from citrulline to vasodilation begins with the amino acid itself. Once absorbed, citrulline bypasses the arginase enzymes that would break down arginine in the gut and liver. Instead, it travels to the kidneys, where it is converted into arginine. Circulating arginine enters endothelial cells and is used by nitric oxide synthase to produce nitric oxide. The nitric oxide then diffuses into surrounding smooth muscle cells, activates granular cyclase, and raises cyclic GMP levels. Elevated cyclic GMP reduces calcium entry and prompts the muscle to relax. This chain of events widens blood vessels and improves blood flow. Nitric oxide is produced when nitric oxide synthase enzymes convert arginine into nitric oxide and citrulline. Once formed, nitric oxide diffuses into smooth muscle cells and binds to soluble guanylyl cyclase. This enzyme generates cyclic GMP, which inhibits calcium entry and leads to relaxation of the muscle. Nitric oxide also reduces the action of vasoconstrictors and makes platelets less likely to stick to the vessel wall. Together, these effects improve vascular function and contribute to blood pressure regulation. Blood pressure is measured as systolic and diastolic values. Systolic blood pressure represents the pressure in your arteries when your heart contracts. Diastolic pressure reflects the pressure when your heart relaxes between beats. Maintaining healthy blood pressure keeps your arteries flexible and reduces strain on your heart. When considering supplements for blood pressure, it is important to understand these fundamentals so you can interpret changes accurately. The diameter and flexibility of your blood vessels determine how much resistance your heart must pump against. Narrow or stiff vessels create greater resistance and raise systolic pressure and pulse pressure. Nitric oxide relaxes vascular smooth muscle, leading to wider vessels and lower resistance. Imagine 3 pipes of different diameters. The narrowest pipe offers the most resistance to flow. By increasing vessel diameter and flexibility, citrulline-derived nitric oxide reduces afterload on the heart and eases circulation. A 2018 meta-analysis pooled results from several clinical trials to evaluate the effect of L-citrulline on blood pressure. The analysis found that L-citrulline supplementation reduced systolic blood pressure by about 4 millimeters of mercury on average. Diastolic pressure reductions were small and became statistically significant only when doses of 6 grams per day or more were used. The trials included doses between 3 and 9 grams per day and lasted between 1 and 17 weeks. These results indicate that citrulline can modestly lower systolic pressure, especially at higher doses, but should not be expected to rival prescription antihypertensive drugs. A more recent review compared the effects of citrulline on brachial and aortic blood pressure. It found that aortic systolic pressure decreased more than brachial pressure, suggesting benefits at the level of the central arteries that are closer to the heart. The reduction in aortic systolic pressure averaged about 6 to 7 millimeters of mercury. Effects were more pronounced during stress, such as exercise or cold exposure. However, the authors cautioned that sample sizes were small and study designs varied widely, so these findings should be interpreted conservatively. Individual trials provide more detailed insights into who benefits from citrulline. In people with type 2 diabetes, taking 6 grams per day for 4 weeks improved flow-mediated dilation, reduced aortic systolic pressure, and even lowered glucose levels. Studies in hypertensive women and individuals with heart failure reported improved brachial flow-mediated dilation and reduced arterial stiffness in both the brachial artery and leg muscles. These promising results are often limited to people with elevated blood pressure or cardiometabolic risk. When healthy older men take citrulline for a short period, blood pressure usually does not change, highlighting that baseline health influences outcomes. Not every study reports significant blood pressure reductions with citrulline. Short interventions lasting fewer than 2 weeks generally show little to no change in healthy adults. Even when reductions occur, they are small compared to the effects of prescribed blood pressure medications. Research varies widely in design, using doses from 3 to 10 grams per day and durations from 1 to 17 weeks. Benefits are more consistent in prehypertensive or hypertensive individuals than in those with normal pressure. One CURE study found that citrulline lowered systolic pressure by roughly 9 millimeters of mercury and diastolic pressure by about 5 millimeters under cold exposure. But such conditions are not typical of everyday training or daily life. Citrulline's performance and blood pressure effects share a common root: improved nitric oxide availability. During training, enhanced blood flow delivers more oxygen and nutrients to working muscles, supporting endurance and reducing fatigue. For vascular health, the relaxation of arteries reduces the afterload on the heart and may lower blood pressure slightly in some individuals. While these mechanisms overlap, the pump you feel during a workout and the modest blood pressure changes are not identical. Understanding this connection helps clarify realistic expectations for citrulline supplementation. There is a myth that citrulline is a natural cure for high blood pressure. In reality, citrulline's blood pressure lowering effect is modest and highly individual. It does not replace prescribed medications or lifestyle interventions such as diet, exercise, and stress management. Another myth is that more citrulline is always better. Taking very high doses does not necessarily lead to larger blood pressure reductions and may cause digestive discomfort. The fact is that citrulline can support nitric oxide production and marginally improve vascular health. But it is only one piece of a larger cardiovascular strategy. Citrulline appears most useful for people with elevated or borderline high blood pressure. Individuals with systolic readings in the range of 120 to 139 millimeters of mercury may experience modest reductions. Older adults often have diminished nitric oxide bioavailability, so they may benefit from improved vascular function. People with insulin resistance, obesity, or type 2 diabetes also show enhanced responses. Athletes looking for a better pump and improved blood flow during workouts might enjoy dual benefits, but they should not expect significant changes if their blood pressure is already well controlled. Healthy people with normal blood pressure may see little to no benefit from citrulline supplementation. If your systolic pressure is below 120 millimeters of mercury, reductions are likely trivial. Those expecting large gains in 1 repetition maximum or maximal power will also be disappointed because citrulline does not build strength the way creatine does. Pregnant or breastfeeding individuals should avoid citrulline supplements because there is insufficient safety data. People who are taking nitrate-containing medications or phosphodiesterase type 5 inhibitors should avoid combining them with citrulline because the combination can cause dangerously low blood pressure. For cardiovascular health, research most often uses doses between 3 and 6 grams of L-citrulline per day. For pre-workout pump effects, athletes often take around 6 grams shortly before training. Starting at the lower end of the range and gradually increasing allows you to monitor tolerance. Split larger daily doses into 2 or more portions to improve absorption and reduce the risk of digestive upset. Keep in mind that higher doses may be required to see blood pressure reductions in some individuals, but more is not always better. Choose citrulline products that clearly state how much pure L-citrulline they contain, and avoid proprietary blends with undisclosed amounts. Dividing your total intake throughout the day can improve absorption. Because nitric oxide production also depends on oral bacteria, avoid antibacterial mouthwash around dosing so you do not disrupt the nitrate to nitrate conversion pathway. Remember that supplements work best when paired with healthy habits such as moderating sodium intake, exercising regularly, and maintaining a healthy weight. Citrulline is generally well tolerated, but there are precautions to consider. It may lower blood pressure slightly. So if you already have low pressure or take antihypertensive medication, monitor your readings and consult a healthcare professional. Avoid taking citrulline alongside nitric medications or phosphodiesterase type 5 inhibitors, as the combination can cause excessive vasodilation. Pregnant and breastfeeding individuals should not use citrulline supplements due to limited safety data. At high doses, some people experience bloating, cramping, diarrhea, or sweating. Starting with a small dose helps you gauge your tolerance. Citrulline is more than just a pump ingredient. By increasing nitric oxide availability, it can modestly lower systolic blood pressure, particularly in people with elevated blood pressure or cardiometabolic risk factors. However, the effect is small and varies between individuals. It is not a replacement for prescribed antihypertensive drugs or lifestyle interventions such as diet, exercise, and stress management. Think of citrulline as one tool among many in your approach to cardiovascular health. To summarize, citrulline is converted to arginine, which fuels nitric oxide production and promotes vasodilation. Meta-analyses show systolic blood pressure reductions of roughly 4 to 7 millimeters of mercury, with smaller diastolic changes. Benefits are greatest for people with elevated blood pressure or cardiometabolic risk factors. Typical supplemental intakes for health are 3 to 6 grams per day, while 6 grams pre-workout supports pump effects. Do not rely on citrulline as a substitute for medications or healthy lifestyle choices. Supplements can complement a balanced lifestyle, but they never replace foundational habits. Citrulline may provide dual benefits for athletes seeking both pump and modest blood pressure support, yet the benefits are modest. Keep lifting, prioritize a nutrient-rich diet, manage stress, and stay physically active. Use citrulline judiciously as part of a comprehensive approach to health, rather than a magic solution. Staying informed and listening to your body will help you make the most of your supplement strategy.